The prognosis was not good when two American missionaries were infected with Ebola in West Africa. The virus has killed more than 1,300 people there. The Americans were flown to Atlanta for urgent treatment. Well, now both have been released from the hospital, one of them just today, and he called it miraculous. Here's Dr. Jon LaPook.
Missionary Dr. Kent Brantley thanked the many strangers who prayed for him and the medical team that cared for him.
You treated me with expertise, yet with such tenderness and compassion. For the last 3 weeks, you have been my friends and my family.
The CDC said Brantley and his colleague Nancy Wrightbowl, who also contracted Ebola in Liberia, have no trace of the virus in their blood and pose no public health risk. Wrightbowl left the hospital on Tuesday. Doctors say the two are now immune to the strain of virus responsible for the current outbreak.
I'm thrilled to be alive, to be well, and to be reunited with my family.
Brantley said his wife and children went back to the States on July 20th as the Ebola outbreak in Liberia worsened. He then threw himself into his work, which included transferring sick patients to an Ebola isolation unit.
3 days later, I woke up feeling under the weather. As I lay in my bed in Liberia for the following 9 days, getting sicker and weaker each day, I prayed that God would help me be faithful, even in my illness.
Though it's not known how they caught the virus, Brantley said they followed infection control protocol. CBS News has learned the two may have had contact outside of work with a Liberian healthcare worker who later died of the disease.
Please do not stop praying for the people of Liberia and West Africa and for a quick end to this Ebola epidemic.
The doctor in charge of the special unit at Emory says the medical team has learned specific lessons about treating Ebola, such as how to manage fluids and correct problems with blood chemistries and clotting. Doctors are planning to send guidelines to practitioners on the ground in Africa in the hopes of improving outcomes there.
Thanks, John.